Now let's talk about the diagnosis of PWS during pregnancy. See, Prader-Willi syndrome is not one of the syndromes which is so easily caught during like in pregnancy, because there are certain things, like if you're suppose in prenatal scan, if your baby is moving too less, the movement is less, the doctor tells you to keep count, right? The movement is too less, it can be a sign of this PWS or any genetic condition. Sometimes hypotonia can be diagnosed, I guess. It is related to the low movement of the baby. Other thing is the intrauterine growth restriction, which I was diagnosed with at 27 weeks. Okay, these are certain things which could be related to some genetic conditions like PWS, but these are not definitive tests. Like even if they see something, they will suggest you to do some other tests. Okay, now let's come to the non-invasive tests, which are this NT-NB scans. Okay, which was normal for me. Then double marker test. Double marker test only checks for 3 genetic disorders, which are like Down syndrome, Edwards syndrome, and something called Patau syndrome. I'm not sure. There are 1,000 other genetic conditions which cannot be diagnosed through double marker test. Okay. Now there is another test which is non-invasive prenatal testing, that is called NIPT, which can sometime pick certain genetic conditions, but not always PWS. I'll tell you why. There are different types of PWS. Okay, in one type, which is the most common type, there it is a case of deletion. A particular region on the chromosome number 15 gets deleted due to mutation, and that can be picked up by NIPT. That also, I think not all it needs some special panel or something, I'm not sure. But there are other types of PWS where the sequence of the that particular chromosome is not changed, and I don't think this NIPT can be picking that. Yeah. So even if NIPT picks up any genetic issues or any abnormalities in the fetus, it has to be confirmed. Okay, because these tests are not definitive.